Before a patient joins the Long COVID-19 platform, they can learn more by going through the following onboarding steps. During each step, they'll receive some information about the purpose of the app and how their data are used to help them decide if they would like to provide consent and join. So let's get started. Data are gathered through weekly symptom surveys, and the person has the ability to share their Apple Health Kit data, such as from a medical record or their physical activity. We have a privacy policy that they can review, and all data are stored in Google Firestore and BigQuery. The data are stored securely and are not used outside of our research team. The time commitment is minimal, and we estimate it will take about 5 minutes to complete each survey. We give them more information about the survey here, and they can withdraw from the study at any time. So this is the full consent form that the person can scroll through, and then they can agree to be part of the study. The person then signs the consent form by inputting their first and last name, followed by their signature. Once they have consented to join, they then register with a username and password. This is followed by logging in with that username and password. They can also set up a passcode that is entered each time they use the app to protect their health information. They have the ability to contribute their activity data to help us study the long-term effects of COVID-19. And they can also contribute their Apple Health records. They can choose which part of their health record is shared, such as their allergies, clinical vitals, or other conditions. And then they can decide how they would like to share new records every time they see their doctor. So following the onboarding process, there's a warm welcome message, and we ask them to get started by completing a one-time background survey, which asks about their sociodemographics and clinical characteristics, such as when they were diagnosed with COVID, if they've had the vaccine, and any comorbidities. The symptom survey is scheduled for them to complete each week, and I'll start that now. This survey is an open-source National Institute of Health Global Health Survey. The person rates various aspects of their physical and mental health on a 5-point Likert scale. And after answering the 10 questions in the survey, they can also enter any other symptoms that they might be experiencing. And we're planning to use the Google Healthcare Natural Language API to detect these symptoms written in free text responses and then map them to clinically validated medical terminologies to group related symptoms together. On the dashboard tab, patients can view their survey responses over time. They can also expand their chart by zooming in. And they can also compare their physical and mental health survey responses to the data that they share from Apple Health, such as their steps or sleep data. On the Resources tab, this contains some information about points and rewards to try to engage patients in completing their weekly surveys. Each time they complete a survey, they earn a badge, such as the Night of Hand Sanitizer. They can also access resources for clinical studies and trials related to long COVID, community forums or online support groups here. And they can also contact a member of their care team, as these patients often have multiple specialists involved in their care, such as a primary care provider, infectious disease specialist, or a pulmonologist. Lastly, on the Profile tab, they can change their preferences, view the consent document, or withdraw from the study. This app is the first component of the Viranos platform. The second part is the clinician dashboard here. The dashboard can be integrated within an electronic health record, as we've simulated here. This is a custom dashboard that we built after the BioDesign Cardinal Kit Build-a-thon, and it's also hosted on Google Cloud Platform using App Engine, BigQuery, and the Healthcare API. We also use the Smart on Fire API, which allows data from our app to be securely exchanged and compatible with nearly any type of EHR. On the dashboard, we can see the overall trend of our patients' composite physical and mental health scores that are reported each week. We can also view a log of symptoms that are reported by our patient. Here we can see that the patient has reported fatigue in the free text in the survey, which is mapped to a healthcare ICD-10 code here. And each instance of fatigue is shown by a red box. Getting data from outside of the electronic health record has been very challenging for the healthcare industry due to a number of technical and clinical challenges. This is important because it allows clinicians and researchers to access the data collected from our app in combination with the patient's health record to inform medical decision making, and perhaps the clinician could also contact the patient when their symptoms are worsening. Our work is publicly available on GitHub and contributed towards the open source framework at Stanford's Cardinal Kit for other healthcare developers to use as an initial starting point. And this could be tailored to other health conditions beyond COVID-19, such as hypertension or diabetes. We plan to deploy our platform at a long COVID clinic to assess how feasible and usable this is for patients and their clinicians. Thank you everyone for listening, and we're happy to take any questions.